Hello everyone. So I'll be talking about asthma. Asthma or reactive airway disease is an abnormal bronchoconstriction of the airway. In other words, the bronchi are hyperresponsive, usually due to certain triggers. Now there are many triggers, but I want to mention infections are very important. Cold weather can trigger an asthma attack. Medications such as aspirin or NSAIDs or beta blockers, all those can trigger asthma attacks. Also pollen, which is a very important factor, especially during spring season. Now, if we take a closer look to the airways, we can see that they're surrounded by smooth muscle. In an asthma attack, those smooth muscles contract and increased mucus production occurs, all in all constricting the airways. Now, this gives symptoms of wheezing, cough, shortness of breath, hyperventilation, and chest pain. Now, what's the initial diagnosis? The first step we do is look at the ABGs. We can see low CO2 levels, hypoxia if severe, and the next step we do is the peak expiratory flow, which is decreased due to the obstruction. Now we can administer albuterol and see if the patient responds. If there is a 12% increase in the FEV after giving albuterol, we can be sure it's asthma. Now, what if the patient comes to the clinic being asymptomatic, not having any symptoms? What do we do? Now, what we can do is do the methacholine challenge test. What it does is it triggers the asthma attack via muscarinic binding. And if we have a decrease of 20% of the FEV, this means we have asthma. Now, how would we treat asthma? The first step is always give short-acting beta agonists, such as albuterol. Second step, inhale corticosteroids like fluticasone. Third step can be either a long-acting beta agonist or increasing the ICS dose. Fourth step is maximum inhale corticosteroid dose. Fifth step, if we have increased IgE levels, give omalizumab. And the sixth step is oral prednisone. Now, what if there's an acute exacerbation of asthma? The main four steps are, first of all, giving O2, then albuterol, then the steroids, and then ipratropium, which is an anticholinergic. I hope you liked the video. It's my first time that I do this, and let's see your response. Put a like if you like it, dislike if you don't, and thank you.